If you have pain, numbness, or stiffness in your hand or wrist, you might be wondering if you have carpal tunnel syndrome or arthritis. These conditions can cause overlapping symptoms, but they affect different structures in your hand and require different treatments. Understanding the differences can help you and your doctor figure out what's really going on. Hi, my name is Dr. Mark Gruner. I'm a board-certified sports medicine physician. Carpal tunnel syndrome is one of the most common conditions that I treat in my practice. So how is this different from arthritis? Carpal tunnel syndrome happens when the median nerve, one of the main nerves in your hand, gets squeezed as it passes through a narrow tunnel in your wrist. This compression can cause numbness, tingling, or even burning pain in your thumb, index, middle, and part of your ring fingers. Sometimes patients can also have weakness in their hand. The weakness may become more obvious if you're trying to grip something or pinch something. Some people may report that they are dropping things more easily. Carpal tunnel symptoms often get worse at night or after repetitive activities. These include things like excessive typing, texting, or using certain tools. Some patients can find temporary relief by shaking or massaging their hands out. Arthritis, on the other hand, is when the joints in your wrist become inflamed, stiff, and sometimes deformed over time. The most common type of arthritis is osteoarthritis, which results from wear and tear of the cartilage. The second one is rheumatoid arthritis, which is an autoimmune condition that might affect multiple joints and attacks the joint lining. Arthritis can cause joint pain, swelling, stiffness, and reduced range of motion, especially in the morning or after a period of brief inactivity. The pain tends to come within the joint itself, not from the finger's nerve distribution. Over time, the joints may appear enlarged, bumpy, or misaligned, and you might hear grinding or clicking when you move them. So how does a doctor like me tell whether your symptoms are from carpal tunnel syndrome or arthritis? With carpal tunnel syndrome, the main clues are numbness and tingling, specifically in the fingers, usually the thumb, index, middle, and part of the ring finger. You might also have subtle weakness on exam, and pain that gets worse with repetitive activities like typing or using tools, and symptoms that flare up at night, but often feel better if you shake your hand. With arthritis, the problem is inside the joint themselves, not the nerves. You may notice deep aching pain, stiffness, and swelling in the wrist or finger joint. The joints may look enlarged or bumpy over time. Morning stiffness is common, but usually improves as you start moving. That may get worse again later in the day with heavy use. In short, carpal tunnel affects the nerves, while arthritis affects the joint, and doctors use those patterns to tell them apart. Doctors sometimes use special techniques or studies to tell carpal tunnel apart from something like arthritis. For carpal tunnel, they may perform special tests such as the Phelan maneuver. In this maneuver, the doctor will bend your wrist forward to see if you have symptoms. Another test is looking for a Tinel sign. In this, the doctor may tap on the nerve to reproduce symptoms. For arthritis, your doctor will check for swollen or tender joints and may also want to order x-rays or other tests. There are two other tests to diagnose carpal tunnel syndrome. One of the tests is a EMG or electromyography. That's where a doctor, whether it's a neurologist, a physiatrist, will put nodes on your hands and fingers and measure the speed and conductivity of the nerves. That can break carpal tunnel into mild, moderate, or severe severity. Another test, which is done in the office, which is non-invasive and is readily available in conjunction with your physical exam, is diagnostic ultrasound. That test is where we look at the median nerve under ultrasound. And if the nerve is swollen, we know that someone might have carpal tunnel syndrome. In fact, if the median nerve is greater than 10 millimeters in cross-sectional area, we know there's a 92% chance that they might have carpal tunnel syndrome. If it is 11 millimeters in cross-sectional area, that might be 96% confident. So these two tests are tests that we can use in conjunction with the physical exam to make sure that we have the correct diagnosis of carpal tunnel syndrome. Also, it is important to note that some patients might have carpal tunnel and arthritis at the same time. This can happen especially in people with rheumatoid arthritis, because this disease actually increases the risk of developing carpal tunnel syndrome and causing inflammation of the wrist joint. If you have hand pain, numbness, or stiffness that doesn't improve with rest, it's important to see your doctor. Early diagnosis can prevent long-term nerve damage, joint deformity, and long-term disability. Effective treatments from wrist splints, and anti-inflammatory medications to steroid injections or surgery can help restore comfort and function to your hands. What questions do you have about carpal tunnel syndrome? Drop them in the comments below and I will try to answer them in a future video. Hope you found this helpful. Remember to hit like and subscribe below, and I will see you in the next video.